Hey, my sister, and welcome to Sister to Sister Empowerment Summit. I am Micah Dixon from Cleveland, Columbus, Ohio. I want to say thank you for being here, and we're going to get right into what we have for you, some education on healthcare, and then some more fun and excitement, okay? I am with today Community Marketing Representative from Caresource, Helena Ravi. Please join me, Miss Ravi.
Hello, thank you so much for having me, Micah.
Yes, thanks for being here. How are you?
I'm well. Just trying to get accustomed to this cold weather again.
It's Ohio. Like,
I know.
the chapped lips need the water. The heat is on 80 degrees, right, in the house.
Yes.
So before we get into the good, meaty part of our conversation, tell me about yourself, and then tell me about Caresource. But first, though, about you, Helena Ravi.
Yes, absolutely. So I am one of many community marketing representatives here within the state of Ohio. What we do, we provide education and information on CareSource, medical plans, and also benefits. So that's particularly my role. We do this in front of the audience of our CareSource members, also other consumers who are wanting to know more about CareSource, and also businesses and community partners.
I love it. The word
Mhm.
benefits caught my ear.
Yeah. And then absolutely. And just some other information about CareSource and what we do as an organization. We are a nonprofit. We do navigate government programs through in-person assistance. Um, we offer resources for community-based organizations for information on health insurance, specializing in government programs. Um, the eligibility is based on household dynamics with
Yeah,
some of those government programs. We don't determine the initial eligibility. That goes through the state government with Job and Family Services and Ohio Department of Medicaid. But we do have offerings through Medicaid, Marketplace, and Medicare. And it is currently open enrollment for all of the plans.
got you. So I want to rewind real fast. You said you do determine it based off of household dynamics, right?
That is correct.
So
Mhm.
just a quick, hop in real quick. What are the household dynamics? Is it like the income? Is it the amount of kids or family?
That is correct. So, say for instance, if someone is looking to apply for Medicaid, we would, well, Job and Family Services, who makes the initial determination for eligibility, they will look at the household size as well as the income that's coming into the home and any other like unearned income, like
Yeah.
child support being received and things of that sort.
Okay, so that doesn't fall on Caresource.
No, it does not. We're the
That's good
next
to
step.
know. That's
Mhm.
good to know because I would have been mad at y'all. I'm like, I'm trying to get this for my kids, and you over here. Another question I do have, Helena, I want to find out. I'm a working mother, but some mothers are not working right now, and they again have children. Are they able to get care source? Do they cover women who are not working with children?
Yes, we do. And again, the initial eligibility will fall under Job and Family Services within the county that you're in. They would make that initial determination, but if a person is not working and there's no income being received, they do have children, that would qualify an individual most likely for Medicaid. And at that point in time, they'll be able to choose CareSource.
Got you.
Mhm.
So, job and family services determines who can get care source or not. So, I'm a working woman with children. Can you call them for me and say, can you put Micah on his plan?
Unfortunately, I won't be able to call for you, but you would have to do that yourself as a consumer, a Medicaid beneficiary looking at selecting a managed care plan. And you could do that by calling the Ohio Medicaid Hotline to make that selection.
Thank you for that.
You're welcome.
Continuing on, Miss Helena, let me know. You said open enrollment is currently open for all plans with CareSource.
Yes. So, and I
Okay.
can give you that breakdown on how people enroll. So, for the Medicaid open enrollment, um, That official open enrollment month is December this year, so December 1st through the 31st. But anyone who wants to enroll in a different plan, they can do so right now. And they can do so by calling the Medicaid hotline number at 1-800 324 8680. And that's for Medicaid.
Okay.
For our Marketplace product, Marketplace open enrollment is from November 1st through January 15th this year. It has been extended. And if an individual wants to contact one of our Marketplace specialists, that number is 1-844 539 1733. And for our Medicare product, and Medicare overall, the open enrollment for this year is October 15th through December 7th. And we do have a Medicare specialist here in the state of Ohio. Her name is Carrie Trotter. And she can be reached at 216 312 9563, and she would be able to direct the person to the appropriate Medicare specialist in that area. So right now, it is the time to be considering and making health insurance decisions and selections, because that, there are some time limits on those things in those areas.
So get in where you fit in.
Yes.
I do have a question about Marketplace. I'm not hip to what Marketplace really is. Is that an actual insurance, or is it where I go to find out what's right for me?
Yeah, so Marketplace is real insurance. This was created by President Obama, and is through the Affordable Care Act, and it's a health exchange. So individuals can go out on the health market exchange through cms.gov and look at different options for health insurance. Caresource has been out there on the Marketplace and offering coverage since its inception in 2014. So we've remained our commitment to serving in the Marketplace sphere and area.
Got you.
Mm-hmm.
So, Helena, tell me, why would someone want to choose Caresource as their next health insurance provider?
Yeah, absolutely. So, why Caresource? Well, we do have robust incentives to promote our overall health and wellness. We also meet people where they are to support and connect them to community resources. And another reason why someone would choose us is because all of our members have an option to enroll in our life services program, which does include a certified life coach.
I love it. So I'm going to pause you on the word life services. One question I do have is, does Caresource cover routine tests? If I got something going on, they going to cover me on that?
Yes, Caresource does cover routine tests. So like mammograms and things like that. Yes, Caresource does cover those routine tests.
Okay, so before I switch over to Caresource, can y'all help me get my money back from the other health insurance I've been paying, who I haven't been using and going to see, but been spending so much money with them?
Oh, I'm sorry, Micah. I don't think we can help you with that.
Oh, you said robust incentives Caresource offers. So what does that entail, if you have some tea to spill for me on that?
Yeah, so some of our incentives that we do offer, we do have wellness rewards programs. Currently, through the end of this year, there's a Babies First, a Kids First, and a Women's First. And those basically gets our members, well, actually, our members have to elect to sign up for that. They're at no cost, but they would do so signing up for those rewards incentives programs by contacting member services. But what that does is we reward our members for making their doctor's appointments for routine checkups, dental exams, vision screenings, health screenings, women's health screenings, and there's certain dollar amounts that are either loaded onto a gift card or either points that are received towards certain stores that they can redeem them. Starting January of this coming year, in January 2022, the amounts on those programs will be increased. So, yeah, you can definitely go out to our website, contact me or any other community marketing representatives to find out more information about those wellness incentive programs.
I love it because you said money on a gift card.
Yes.
You
And
know,
if it's things that you already do as well, such as going to the doctor, doing your routine checkups, why not get rewarded for them?
I love getting rewarded. So I'm
Mhm.
going to look into that.
Yeah.
So life services is what caught my attention when it came to Caresource as I was looking over today's agenda. Um, and I want to say to Caresource and to you, thank you for thinking about the people who from going through a pandemic and losing their job to trying to feed their children to just trying to get through their day and having to adjust to having a different mental health, uh, and probably from being depressed. Life services caters to, not just your health insurance, right?
Yes,
So
it doesn't.
tell me more, Helena, about life services, what it caters to. And this is a real big thing for me and for CareSource. And I want people who are tuned in right now to really get what this is. This is huge.
Yeah, so our life services department within CareSource, it's our CareSource's brand of the social determinants of health. So the life services area, it's there's pillars to this, and it includes our Job Connect program, but the pillars are workforce development, housing, food, and nutrition, as well as health equity that we look at.
Mhm.
Um, did you want me to give you more about the social determinants of health? And
Yes.
okay, absolutely. So the social determinants of health, it focuses on the person outside the patient. And it also looks at socioeconomic factors, which is 40% of a person, such as education, job status, family and social support, income, community safety, and it also looks at a person's physical environment, which is 10% of the makeup of a person's overall just person and profile of themselves.
Yeah.
We also look at the health behaviors, which is 30%, and this includes tobacco use, diet and exercise, alcohol use, sexual activity, as well as healthcare in itself, which is 20%, and that includes access to care and quality of care.
Wow.
So we look at all of these with the social determinants of health in when we created our life services program.
Wow.
Mhm.
You also receive a life coach if you also get the life services options, correct?
Yes, that is correct. A life coach and that coaching approach, the member that's where the member defines their goal, and the certified life coach supports the member in obtaining that goal.
Beautiful. I love that. I have a life
Mhm.
coach. I've had one for years now, for the past 10 years now. And I
Oh, that's
gotta say,
fantastic.
yeah, people are gonna love this. Having someone to talk to who can also help me reach where I want to go in life. I'm big on talking about a person's mindset because how you think is who you will become and where you are
Yes.
going. Having a
Hmm.
vision is how you're going to know where you're headed. If you don't have a vision, you're just wandering every direction. So this to me is like, what? They did this for the people?
Oh
No
yeah.
way. Wow.
Yeah. Yes, and that's one of the unique differentiators of our life services program.
Yeah.
Our members are paired with a personally certified life coach who can prepare them for success. And our life coaches, they do provide one-on-one coaching for up to 24 months. And they can connect the members on an individual level and can address needs that's go beyond like physical health and to include the home, workplace, and community by providing a linkage to services and support for finding full-time employment, food assistance, transportation, housing, education or training opportunities, and budgeting and finances. So our certified life coaches can do all of that.
Wow.
And this is all at no cost to our members. So
What?
this is great.
So you telling me I can come over to Caresource and get all of this at no
Yes.
cost?
If you are deemed eligible for any of the plans that we provide, yes,
Yeah.
you will be able to have access to our life services.
I love this. So tell me, why does Caresource care about the social determinants of health?
Yeah, we care about the social determinants of health because good health requires more than just quality health care. Having a good job, community support, and access to education or training opportunities, it impacts your it impacts your overall health and well-being. And that's what, it kind of ties back into the social determinants of health and our detailed studies within that. So that's why CareSource Life Services is here to help our members. We can help remove barriers that stand in the way of reaching a person's goals. And life services can help pave the way from where a person is to where they want to be.
Wow. I love it. I feel like Caresource is in my head already because, again, I'm always about mental health and emotional health and spiritual wellness. And where are you? I love this. We go hand in hand. We're going to be like best friends, Helena. I promise you.
Oh,
So since we had the pandemic, we were coming out of it, still people are getting vaccinated. Some people are, walking out of their jobs. What trends are you anticipating from your life services members coming out of the pandemic?
Yes, there are trend increases in difficulties with affordable housing,
Mm.
unfortunately, as well as available childcare due to a lot of staffing shortages. So we've seen that a lot. Just the job posting signs, the hiring, and things like that. So there is a need that is emerging for childcare as well as the affordable housing. However, our certified life coaches are attuned to these trends, and they conduct thorough and periodic research on resource areas, and that can help our members. So they stay abreast of what these trends are, what's going on, and they also make community partner connections to be able to provide more information and better resources to our members that opt into the life services to receive help.
Got you. And this
Mhm.
is for all of Ohio, correct?
That is correct. All of Ohio.
Okay. And open enrollment is coming up this December. Can you give me the information on that again?
Yes. So for the actual open enrollment month, it is December, the entire month from the 1st through the 31st. However, anyone who does want to make their open enrollment selections now at this time, they can. And they can do so by calling the Medicaid hotline number. And that number is 1-800 324 8680.
And again, to be determined if you are eligible for this, you go through Job and Family Services.
Yes, that is correct.
Okay, making sure I get everything I need to know before I be like, Helena, you told me. Okay, so my last question for you, Helena, is tell me, why do you love Caresource? And this could be from the heart. It could be, what's their mission statement? I know they always say you're not just covered, you're covered with kindness. So, you work for this company. Tell me, why do you love Caresource? And, why should people step over and come over here?
Yeah, so as you know, might have read, our mission is to make a lasting difference in our members' lives by improving their health and well-being. Well, I love Caresource, and I made a deliberate move to join this organization, this amazing organization, because before joining, I saw how Caresource lived the mission. They we're always out in the community, we're always serving, and that's what it's about, and being involved in the communities where we offer and provide coverage and service. We're at the ground, we're out there interacting with the people and making sure that our members and our businesses that we also partner with and other organizations, they know that we're here.
I love it.
So yeah, so I loved it. And our organization is very responsive. So these are some things that stuck out to me
Yes.
prior to joining the organization. And
Yes.
now that I'm here, I love to continue that.
You can tell that that's you too. You know that, right? Your spirit just says that.
Oh,
It's,
thank you.
give back is there. You can see, you can feel it. Helena, Robbie, everyone, our community marketing rep for Caresource, amazing. Open enrollment is happening in December. You can call the Medicaid hotline at 1-800-324-8680. If you want to hop over to Caresource, like I'm about to hop over to Caresource, then go to your job and family services and get your determined eligibility. And also, life services is new, but I love it. I'm here for the job connect, the workforce, the housing, food, nutrition, health equity, and getting a
Yes.
life coach so I can get to my dreams.
Yes.
But thanks for joining me. I appreciate your time and you pouring into the women who are tuned in right now. Thank you for your service and your work in the community as well. And I am going to check out of here, but it was nice to meet you and talk to you. Have a great day.
Thank you, Micah. It's been an absolute pleasure.